Hello everybody and welcome to my channel. I'm Mariah. Today's topic is spinal cord injury. This is a research video. For the research in this video, I used an article to gather information for this topic. The link to this article will be in the video description box. If you're interested to know more after you've watched, I've linked my social media account in the video description box. If you like or enjoy my content, I would appreciate it if you would subscribe, like, share, and leave a comment and/or any suggestion you have below. You can support my channel by becoming a patron. The link to my Patreon will be posted in the comment section below. Thanks a lot. Now let's get into today's topic. The article that I read was titled Spinal Cord Injury from the Cleveland Clinic website. Overview. What is a spinal cord injury? The spinal cord relays messages between the brain and the rest of the body. Layers of tissue, called the meninges, and a column of vertebrae, which are spinal bones, surround and protect the spinal cord. Most spinal cord injuries come from a sudden traumatic blow to the vertebrae. The fractured or broken bones then damage the spinal cord and its nerves. In rare cases, an injury can completely sever or split the spinal cord. How does a spinal cord injury affect the body? The body loses many essential functions if an injury means nerves cannot communicate with the brain. A damaged spinal cord can affect the bladder and the bowel or intestinal function, breathing, heart rate, metabolism, or the body's processing of converting food into energy, muscle movement, reflexes, and sensations. Is a spinal cord injury the same as a back injury? A spinal cord injury is not the same as a back injury. Back injuries may damage bones or soft tissues in the spine, but they do not affect the spinal cord. What are the types of spinal cord injuries? Spinal cord injuries can be complete or incomplete, or which is incomplete or partial. Complete. A complete injury causes total paralysis or loss of function below the level of injury. It affects both sides of the body. A complete injury may cause paralysis of all four limbs or the lower half of the body. Incomplete. After an incomplete injury, some functions remain on one or both sides of the body. The body and brain can still communicate along certain pathways. Symptoms and causes. How do spinal cord injuries happen? Some possible causes of spinal cord injuries, from most to least common, include motor vehicle accidents, falls, gunshot wounds, sport injuries, or surgical complications. What are the symptoms of a spinal cord injury? Spinal cord injury symptoms depend on the type, which are complete or incomplete, and the location of damage. Get immediate medical attention if you notice any of the following issues after an injury: weakness in arms or legs, decreased sensation in arms and or legs, loss of bladder or bowel control, severe pain or pressure in the neck or the back, unusual lumps around the spine, difficulty breathing. We have diagnosis and test. How is a spinal cord injury diagnosed? In an emergency, a healthcare provider makes sure a spinal cord injury is not affecting your breathing or heart rate. Next, they'll assess how well your nerves are working. The provider checks motor function or your ability to move parts of your body, and sensory function, your ability to feel touch. Certain image testing can help diagnose a spinal cord injury. We have CT scan to see broken bones, blood clots, or blood vessel damage. We have MRI to see the spinal cord or soft tissues. And we have X-ray to show broken bones or dislocations, which are bones knocked out of place. A healthcare provider may also use an EMG to check electrical activity in muscles or nerve cells if there are coexisting peri per Harold, I'm sorry if I said that wrong. Nerve injury. EMG is usually not necessary in a spinal cord injury. Management and treatment. What is the immediate treatment for a spinal cord injury? You may need emergency surgery for a spinal cord injury if there's trauma to another area of the body. Surgery can also address spinal cord damage from broken bones, blood clots, or damaged tissue. Some research suggests that a corticosteroid injection may help spinal cord injuries. The medication should be given within 8 hours after the injury occurs. The medication may improve blood flow, preserve nerve function, or reduce inflammation. What is the long-term treatment of spinal cord injury? For a spinal cord injury. Long-term goals of spinal cord injury treatment include enhancing independence and quality of life, reducing the risk of chronic ongoing health conditions, and restoring some nerve function in partial injuries. Long-term complications of spinal cord injury may include inability to regulate blood pressure or body temperature, increased risk of heart or lung problems, loss of bladder or bowel control, paralysis in arms or legs, persistent pain, sporadicity, I'm sorry if I said that wrong, joint contraction, or sexual dysfunction. Will I need rehab after a spinal cord injury? Most people with a spinal cord injury will need some form of physical rehabilitation or therapy. You may need inpatient, which is during a hospital stay, or outpatient after a hospital stay rehabilitation. A rehabilitation team can help you learn to use assistive devices such as walkers or wheelchairs, regain strength and mobility in areas of the body with nerve function, and recover the skills needed for activities of daily living, or ADL, including dressing and using a toilet. Prevention. How can I prevent a spinal cord injury? You can reduce your risk to a spinal cord injury by avoiding fall hazards such as ladders, driving safely and wearing a seatbelt in motor vehicles, wearing appropriate protective gear during sports. Outlook/prognosis. Are spinal cord injuries permanent? Complete spinal cord injuries are usually permanent. Incomplete spinal cord injuries may allow for some functional improvement over time. I hope this video helps someone. As some of you may know, I have problems with pronunciation, which is because of my learning disability, which I am dyslexic, and I also have other disabilities too. I don't try to hide this because I want people who have similar struggles to know that they aren't alone. No matter how hard pronouncing some words may be, I will always try my best. Those are the reasons I leave my mistakes in these videos. I am always open to any suggestions you have for any future video topics. Please let me know what they are in the comment section below or on my Twitter page, and my Twitter handle is @BurleyMariah, and that's my last name and my first name, and I'll spell it for you. My last name is spelled Burley, and my first name is spelled Mariah. The next video will be on the topic multiple sclerosis, which will be available on my Patreon on Wednesday, May 3rd at 6 p.m. EDT, and on my YouTube channel on Saturday, May 6th at 6 p.m. EDT. Hope everyone's continuing to stay safe. I will post my notes in the comment section for anyone who needs them. Feel free to share this video with anyone you think might benefit from watching it. If you want to be notified when I do any live streams or upload any new content, you're going to want to click the bell icon and select the all options under the bell icon. Thanks for watching. I love you guys. Bye.